Good morning. This is Tom Goddard, founder and CEO of Integral Healthcare Solutions, accreditation healthcare consulting firm specializing in URAC, NCQA, ACHC in particular, but also others. Just want to reflect this morning on what I've read in the morning's healthcare news and a couple of ruminations about them. First of all, I get my first COVID vaccine tonight, probably Pfizer, a little drive-through operation I've got going at the University of Arizona here in Tucson. And I'm excited about it. I'm not judging anyone who, for their various reasons, are not getting it or are holding off on getting it until they can see more of the side effects, in particular cases like folks who have chronic viral issues. But I'm getting mine and I'm happy about it, happy to restore some level of comfort in myself about particularly flying. I haven't been on an airplane in a year, and airplanes have been a big part of my life, and just the notion of getting into a metal tube with 200 of my closest non-friends in such uncertain times has not felt safe or advisable, but this will now, I think, free me up to feel safe, at least safe enough to fly again. Not that I have any clients who want me to come to their homes or their offices, but at least that's a growing possibility. I read that the Biden administration, on a totally different subject, the Biden administration is reaching out to a group of, I think, 8 states with a sweeter deal on Medicaid expansion. This is, as you'll recall, a feature of the ACA, or Obamacare, that induces states to expand their Medicaid programs with the promise of more federal funding as the inducement to do that. A whole lot of states, particularly in the South and Midwest, have held off doing that. So there are a whole lot of poor folk and medium to poor folk who have not been able to get access to health care, either in the marketplace because they can't afford it, or in their, for whatever reasons, through their employment. So this seems to be good news for particularly a segment of the country that particularly needs healthcare coverage. And then finally, I just want to comment on, as my own sense of ease around the lifting of my own fears around COVID that comes with the vaccine, tend to have me start to feel like engaging more in social encounters in the coming months. I'm noticing that Fauci and other folks who are in charge of looking at the public risk are freaking out because that whole attitude is spreading across the country, and I can understand their concern. We tend to act a little early, I think, on such matters. I think we're probably going to start, as a society, really relaxing lockdown measures too soon for public health sake. Because of our impatience to get out of the essential prison we've been living in for the last year. I'm not a big advocate of prisons, so if we can somehow balance our need to escape from our social consciousness to make sure that we aren't blowing up our hospitals and each other with taking undue risks with ourselves and with each other's health. It'll be interesting to watch. Frankly, I wouldn't bet a nickel that we'll do the right thing as a society in that regard. I think people's impatience will probably outweigh their prudence, and I think people will suffer and die as a result of that. This is not me being cynical, it's me just being an observer of human behavior, generally in human behavior over the last year. So it's an interesting time to watch from a public health perspective, and to kind of incorporate that into our personal lives. At what point do we, start feeling more comfortable walking into public spaces? I'm going to keep masking because the science is not fully in on whether, even after I'm fully vaccinated, whether I might be a spreader. So I'll continue to wear masks. In fact, I've been double masking lately per the CDC's recommendation, and it's not a big deal to double mask. I've got a KN95 and a cloth mask to go over that, and I suspect that that'll keep folks around me safe even after I'm I'm fully safe myself, or largely safe myself. So that's my reflections on the day.